Thanks very much, Gretchen, and thanks to DDEA colleagues for this kind invitation. The opportunity to talk about our work is always, really appreciated. And yeah, I hope that what I have to say and what Emer has to say will be of interest to you. So the brief that we were given was to introduce you to public and patient involvement, which is an approach to research in health and social care that is present in many countries, but has really been developing in Ireland in the last 5 years. And I'm going to describe some of those developments, and hopefully some of what I have to say will resonate with yourselves as early career researchers. Emer will then talk about a particular study and her involvement with PPI through that study, which will be sort of drilling down into a little bit more detail. I'll be at that sort of helicopter level, maybe looking at how we promote this approach in a research ecosystem like we have in Ireland. Emer will be getting down to more to brass tacks and discussing some of the nitty-gritty. So yeah, I hope it's of help. We'd be very happy to answer questions. My own experience of involving patients in research has been tremendously rewarding for me, both personally and professionally. And you'll hear in Emer's presentation about our young adult work, and out of that experience, I have become involved, as Gretchen said, with leading a network. I really like the name of our network. The network is funded by the two main funders of health and social care research in Ireland, the Health Research Board and the Irish Research Council. And implied in the name, about 5 or so years ago, they wanted to really ignite PPI as a new approach to thinking about and doing research. So what do we mean by public and patient involvement? Well, I like this explanation, or this cartoon to explain it, because it speaks to the continuum of involvement. It can be at a very basic level of just sharing information with members of the public or patients in a disease area of interest to you as a researcher. You can explore consultation with people who have lived experience of the condition that you are studying or that you're interested in. You can progress through involvement, where you jointly plan or co-design a research study, or perhaps describe or outline research priorities. And then at the sort of higher end, you actually, there are examples of members of the public or patient groups initiating the research and being involved right throughout the whole process, from inception through design, delivery, analysis, and interpretation and dissemination. And occasionally examples of people with lived experience taking a study through that entire process. So you don't have to join at this top end. Most people explore PPI initially through perhaps consultation, but I would encourage you to think about the ambition being to have people living with the condition that you're interested in get more involved in your research. So to explain how we are organized in Ireland, we have 7 of our main universities are part of our PPI Ignite network. These are the 7 universities on the screen. Along with Edel Murphy, who's our national office program manager. She and I coordinate the network from a national office, but the 7 universities, we call them lead sites, are networking to promote and develop PPI as an approach, but they're also involved with local partners in actually supporting public and patient involvement in individual studies. So taking University College Cork as one example, and I could show you this for any of the 7 lead sites. They have examples, they have local partners that include other research centres, but also organisations like Inclusion Ireland that deal with people who are on the fringes of society, with people dealing with homelessness, with addiction, people whose voices are seldom heard in the normal discourse around research and engagement with health services. So again, Family Carers Ireland is another example of a partner, a local partner to UCC, who might help them help researchers in UCC to identify topics and questions that are even of importance to their charity or their organization and their members. So I hope you get a sense of a national effort coordinated by ourselves in the national office, but importantly, local efforts at each of these 7 universities. And then in addition, we have 10 what we call national partners. Some are universities like Maynooth and Queen's in Belfast. Some are parts of our health service, like a research and development office within our HSE, child and family within our health service. Some are charities like Health Research Charities Ireland, which is an umbrella organisation for about 40 individual charities, and IPOSI, which brings together a patient platform along with pharma industry to look at involvement in research. And then other networks like Trials Methodology Research Network, Sphere, which is a network that trains the next generation of health services researchers in Ireland, Campus Engage, which is part of our Irish Universities Association and encourages engaged research. So these are our national partners. And then we also have a strong public advisory board, which is made up of members of the public, some with a particular interest or expertise through lived experience with conditions, but others who are just people from the business community, people from minority groups within Irish society who are keen to advocate for their own particular area, but also keen to work with us to drive and build capacity for high quality PPI in Ireland. You'll notice that there are a couple of missing faces, and one aspect of our work is that trying to listen to and tap into what are often referred to as seldom heard voices. But one of our PAB members has had to step back because we insist on remunerating our participants, both study participants in individual PPI projects, but also our public advisory board. And in Ireland, if you're receiving a disability payment, you're prevented from receiving any other payment. This is, we think, an unfair, or puts people who are disadvantaged by virtue of disability, not enabling them to participate fully in the discourse that we would like to have with them and listen to their issues and try to incorporate them into our work as a research network. So, and then finally, as part of our network, we have five experts from international roles. We have 2 people who are involved in the establishing in the UK, establishing an organization called Involve. Beck Hanley and Simon Denegri were involved with this organization, which again was trying to tap into the voice of the patient. And now that has been subsumed into the NIHR, the National Institutes for Health Research. Kelly Dunham is a member of an organization called PCORI, Patient-Centered Outcomes Research Institute in the US. Antoine Boivin is co-director of a primary care community partnership, again, looking at involving communities in setting agendas around research and helping to co-develop and co-deliver. And then Professor Laura Lundy, any of you who work in pediatrics may be familiar with her work. She's a professor in the School of Social Sciences in Queen's in Belfast, who has developed the Lundy model for involving children in research, which she believes is a right. She takes a rights-based approach to PPI. So these are our experts who advise our network on our work. And these are the objectives: to improve the quality of approaches to PPI in Ireland, promoting partnerships that are meaningful to researchers and PPI contributors, to embed PPI at an institutional level and at a national level, to create a nationally coordinated and internationally recognized network of excellence, to create a shared national voice for PPI that will identify as a place to go to for help and leadership in this area, and ultimately to improve the health and well-being of our population. So just very briefly then, our work is multifaceted, as you can imagine. We have 5 separate work packages. Work package 1 is about building capacity across communities, again, focused at the individual lead sites and also at a national level, trying to bring researchers and members of the public and people with lived experience together. Work package 2 focuses on undergraduate and postgraduate students, trying to normalize PPI in the next generation of researchers, so that it's not seen as an added extra or something, you know, that you think about after the fact, but actually it's embedded in how we do and how we think about research. Work package 3 is focused on getting rid of barriers to PPI within institutions. The payment of participants can be very challenging because they're not members of staff of universities, and that's something we've been grappling with. And there are other examples here as well of trying to make it easier to do PPI in your work as a researcher. And then work package 4, led by Trinity, is looking at what is excellence, what does it look like, what does it mean, and then finally work package 5 is building the strong network and developing international connections. So work package 1 is this kind of work, you know, down and dirty, getting, you know, rolling up the sleeves and getting stuck into building those partnerships. Work package 2 is focused on students. Work package 3, getting rid of hurdles, making it easier for PPI to happen. Work package 4, making it first class. And finally, then sharing it with people like yourselves through webinars like this. So some resources that you may be interested in exploring, and I'll put this link in the chat when I come off screen, but we would love you to look at our online hub, which has quite a lot of resources, including a calendar of events, various opportunities for training in PPI, focused primarily at the moment on Irish universities, but increasingly we hope that these resources will be shared with people like yourselves in Denmark and elsewhere. Out of work package 4 has come a values and principles framework. So we believe that PPI is based on certain key values which need to be recognized and worked towards. So respect, trust between the researcher and the PPI participant, flexibility, recognizing that we're paid to do our work, but you know, co-design is not possible unless the people that are bringing their lived experience are recognized for that in terms of their time commitment and other commitments. Transparency, so that there's open communication throughout the process. This one, which is very difficult, I think, for a system to change, because money makes the world go round, and funding for research generally goes to researchers, i.e. universities, but trying to power share and look at funding decisions and funding direction is something that we're trying to address and tackle. Collaboration and partnership is a really key value. And then finally, equity and inclusion, and trying to look at those barriers to people, like I mentioned earlier, with disability or with other barriers to participating, and trying to enable them. So the challenge for us is to embed these values and principles in our work. We've developed some learning outcomes for PPI and Work Package 2 for PPI education, and we're about to launch a module across several of the 7 universities that will be focused on training and education in high quality PPI. And then before my last slide, I just would like to share with you our first festival 2 weeks in October of last year. We had our second festival in October this year, but the infographic is not ready yet from this year's one, but this was a huge success, just bringing people together around the country, online, in person, and events that had a PPI focus were celebrated across the country. So 40 plus events, it was 60 plus this year, and really trying to showcase a lot of the really excellent conversations and work and training that's happening in Ireland. So finally, and perhaps most relevant to yourselves, just what I would consider to be top tips for grant writing with a PPI focus. It goes without saying, read the guidance notes. The funder will tell you what they believe PPI means to them and how they feel, it should be incorporated into your grant writing. You'll hear from Emer about our young adult panel, but I would consider establishing a PPI panel, maybe approaching a charity in the disease area that you are interested in working in, as an approach to listening to that voice or hearing that voice from the public and patient grouping. Find out if your funder uses public reviewers. Our Health Research Board does, and it's interesting to look at the information that they're given as to what to look at. Look at the lay summary, look at the budget, look at the importance of the question to you as a public reviewer. Don't leave the lay summary until the end. It's really important, and ideally co-write it with your PPI participants. Try to embed plans for PPI across the grant application. Many grant applications will have a PPI section, but it looks really good if you have incorporated plans for PPI in other sections of the grant, and it's obvious that you are very serious about it. Include plans for meaningful PPI in your budget. Some people would say that the first thing to look at, if in terms of is a researcher serious about PPI, is to look at how much money they've set aside for that activity within their research program or research project. Provide feedback. A lot of our contributors feel disenfranchised and disrespected when researchers don't get funding and they never find out, or if they do, they don't hear about the outcome of the work that was undertaken. Think about the bigger picture, implying impact rather than the individual project. Be aware of those seldom heard voices that I mentioned, and looking to try to deliver on equality, diversity, and inclusion. And the final lesson, or tip rather, is I think doing PPI in a meaningful way you must acknowledge as a researcher that you don't have all the answers. And I think that's a nice segue into Emer's talk. I'm going to come off screen, and hopefully Emer will be able to share a 2-minute video that is a trailer for a documentary called The Patient Effect, which introduces you to 3 examples of public and patient involvement in Ireland. A young pain researcher who's exploring PPI with a support group living with chronic pain. Sorry, that's the second one. The first one is a dad of a baby born prematurely who's working with a research group that are looking at premature infants and research in that area. And the third one is our young adult panel, which you'll see Emer and myself feature in that. Thanks,
so
Emer.
Sean, I will try to share
okay.
instead of Emer, because perhaps I have figured out how to share it with
brilliant.
sound.
Thanks, Gretchen.
So let me try.
I'm off screen now, I think. Yeah.
Okay, great. Then I will go ahead here. Yes, I think this should work now. So everyone, please tell me if you don't hear the sound. I'm going to start it now.
She looks really weird. Sophia, she was only born at 25 weeks and 4 days.
She was just so small and so thin. Nothing worse than standing there looking at your kid inside a glass box and wanting to hold on to them. The work that I'm doing with a research project is kind of a bridge maybe between the technical medical stuff and, you know, the level that we as parents of those babies are on.
I used to love dancing. We used to love going out social occasions and dancing and that. I can't do that. Oh, Martin would come, but Martin loves dancing too. Dancer.
Patients can give you a completely different perspective on what's important for them. PPI stands for Patient-Public Involvement. So the purpose of PPI is to get input, not just from doctors, but from people who are living with the disease that you're trying to address. Is 9 months pain relief a good target point?
It would be brilliant. Yeah. 9 months, I wouldn't know myself if I got 9 months relief. It would give me back my life again for another while. Plus, my husband would have a new woman again for a few years.
Looking for a new man next.
Young adult diabetes is really difficult. It's a tough condition.
I was rushed into kind of the A&E, and they told us that if I had gone home that evening instead of the hospital, that the likelihood of me waking up the next morning was very, very slim.
It's not easy to change the way we do things in healthcare, but I think we're definitely onto something. I think if you can tap into the voice of the person living with the condition, it's a very empowering approach to research.
Thanks, Gretchen. That worked really well.
I need to stop it again. There we go. Okay. Now it's fine. Thank you so much, Sean, for the really inspirational talk, but also very, very informative. I think DDEA is extremely inspired by your actions and your work, and especially the PPI Festival, as you know, Tor has been over and visiting and learning from you. Do we have any questions from our participants? I would love to ask a question then, if nothing is coming from our audience. There were a couple of things that struck me as you were talking, and one of them is the diversity of your local partners. And I think it's such a beautiful example of interdisciplinarity, but at the same time, it must come with challenges. How do you have such diverse local partners working together?
Yeah, and I may have misrepresented. I mean, each of our lead sites does have a steering group, which includes those local partners and the program manager in the university, and they're trying to do at a local level what we're trying to do at a national level. You know, in other words, to build capacity and to drive PPI locally, but they are mainly focused on their individual, you know, if it's a charity, their individual condition or you know, their members. So several of our lead sites provide seed funding. You know, it may be a small amount of funding, but they're supporting. In the example I gave, like Family Carers Ireland, for example, might be supported to do like a summer research project with a researcher in UCC to try and gather some preliminary data, maybe for a grant application. That's just one example. So yeah, it's this idea of of not just thinking about the national picture, but actually, developing things locally as well.
I see. And such an important effort to be able to get buy-in from all of those local regions as well. Yeah.
Yeah.
I will ask one more question unless someone in the audience has one. Okay, one more for you then, Sean. You had a wonderful list there of top tips for writing grants and taking in PPI into your grant. Do you have any tips for funders, for funding agencies who want to get started in bringing PPI more into the kind of research they are funding?
Yeah, I think that Edel Murphy, who's not with us today, but Edel, I'm pretty certain, has delivered a workshop in Ireland for for organizations that are asking that type of question, Gretchen. And I don't want to, summarize an entire workshop in one comment, but I think a key thing is to have it in your strategy, to plan for it, because it doesn't just happen through, through goodwill or through wanting it to happen. So again, the Health Research Board in Ireland is a good example. PPI is literally all over their strategy. But Edel, I think, would be a good person to connect in with on that question.
That's great. I see a hand up from Nicole. Nicole, please go ahead.
Yeah, thanks for a fantastic presentation. It's really got me thinking. It's definitely the part of the grant that I struggle on the most. I'm like, I really am not sure how I will include. I mean, I'm just a lab scientist. But then I was just thinking now, as you said, well, create a panel and start talking to your patients or the doctors or, whoever's affected by your research. And I was like, okay, what about the ethics on that? Do you need to have human ethics these days for...
Oh, well, that is a really interesting question, Nicole, because just in the last couple of days when I was finalizing my slides, I reached out to Work Package 3 is our work package on I think of it as policies and procedures to make it easier to do PPI within a university. And they actually have been deliberating on the ethics around PPI. And they are very close, and I mean within the next month, I hope, to actually launching a statement that they believe, will capture the very question that you're asking. So the bottom line is that if you were to seek ethical approval to have a statistician as part of your research team, they would laugh at you, I think, in most ethics committees. Yeah. So we believe that public and patient involvement, these people are part of the research team. So there are, of course, issues around GDPR if you're collecting data, but if they are helping you to shape the direction and the detail around your research, then they are, in our mind, PPI participants, and that activity does not require ethical approval. But Nicole, I would say stay tuned, because I have permission. I just literally got it about an hour before I came online to share the statement, and I'd be happy to share it with Gretchen and maybe through the group.
Yes.
Okay,
we can
cool.
absolutely do that.
Yeah, because I guess if you just acknowledged them in the paper, then they are part of the team in some sense, right? So,
but I think what the group have tried to do is separate participants whose on whom you are undertaking measurements, perhaps analyzing data, versus involvement, which is more about listening to the voice of the lived experience voice and helping and having that help you with your work as a researcher. So yeah, I'm not sure that I'm representing the difference properly there, but it's a really relevant question, and I'll be able to share something with you afterwards.
And Pranila and I will be happy to share it forward.
Great.
So thank you so much for the question, Nicole. And thanks again, Sean, for the fantastic talk. And I know you'll hang around till the end in case there's more that comes up. But we have another exciting talk ahead of us. Emer Morrissey is here, and I would just like to tell you a little bit about her background as well. So she's currently a postdoctoral researcher, but she's also a project manager, and she works in the Health Behavior Change Group at the School of Psychology at the University of Galway. She completed her PhD in health psychology in 2018, and her research nowadays really centers on self-management of long-term conditions. And she does have a very strong focus on patient and public involvement. And during the period of 2019 to 2022, she was managing a project that is called the D1 Now study. And that aims to really look at the outcomes for young adults living with type 1 diabetes in Ireland, which you got a little window into in the video that we just watched. So, Emer, I pass the mic over to you.
Great, thank you, Gretchen. And thank you, Gretchen and Pernille and all of DDEA for the invite to talk today. So am I sharing my screen? Does it look okay to everybody?
I think you need to put it in presenter mode, Emer.
Do that now.
Yeah, that looks great.
Yeah, great. Okay, so I'm going to be talking about lessons that we learned in the D1 Now study around obtaining grants that include PPI. So just as a background to the talk, I'm just going to very briefly talk about the background of the D1 Now study. Then I'll talk about our PPI. So we have a panel of PPI contributors who we call our Young Adult panel. So I'll introduce you to the Young Adult panel. Then I'll give some examples of our research and grant writing within our research, and finally reflect on some lessons that we've learned. And I'll also have some personal reflections as an early career researcher. So just onto the background of the study, you're all very familiar with type 1 diabetes. It's an autoimmune condition where the body doesn't produce insulin anymore. As you know, it requires a very intensive self-management regime, and that can be very difficult to balance. It's particularly so for young people who are balancing, the tasks of self-management along with the changes that come with being a young adult. So things like maybe moving away from home, using alcohol, moving from the pediatric health services into the adult services. And what we see is that young people with type 1 tend to have poorer outcomes than younger and older people with the same condition. We also see that young people with type 1 have very high levels of diabetes related distress. So a review by our team, so it was done in 2016, and it reviewed all the interventions that were out there to improve outcomes for young adults living with type 1. There was some interventions out there, but the quality of the research and particularly the quality of the reporting was quite poor, so the results were inconclusive. So I suppose that's where our research came from. So I'll move now on to introducing the Young Adult panel. So the work in Galway started in 2014. So we invited young people who were living with diabetes to join a Young Adult panel and work with the research team. And I suppose just reflecting on the question that Nicole had there and that Sean was answering around ethics and PPI, in our project, we very much see our Young Adult panel as co-researchers rather than participants in the research. And for that reason, we've never gotten any kind of ethics or ethical approval to work with them, because you wouldn't get ethical approval to work with maybe a statistician or a qualitative researcher. We just see them as members of the research team. And accordingly, they have been authors on some of our papers. They present at some conferences on behalf of the team, and also have been included in grant writing, which I'll get to now. So where was I? Work began in 2014. It was very much inspired by a youth mental health charity that we have in Ireland called Jigsaw. So Jigsaw have a youth advisory panel. Now theirs is more focused on the delivery of service rather than research. But we very much drew inspiration from them, and they gave us lots of support when we were setting up our own panel. So you can see there the first ad we used to try and invite young people to join. So 8 young adults initially became involved in the Young Adult panel, and this is a picture from one of the first meetings. If you're interested in learning more about the process of setting up a group like this, there's a published paper about it, and it includes some of the young adults themselves as co-authors. As I mentioned, the app initially had 8 members. And then because our research is focused on young people, so particularly the 18 to 25-year-old period, as time passed, some members were ready to move on. You know, they kind of maybe aged out. So they became 24, 25, 26. So over the years, we've carried out 2 rounds of refreshment where we invited new members in 2017 and again in 2019. So at this stage, over 20 young adults have now been part of the Young Adult Panel, and we currently have 8 members from all around Ireland. So when the research is active, we usually have meetings every month, and sometimes every 6 weeks. It depends on what stage of the research we're at. The meetings are usually online, so that means everybody can attend them because we have members from all over the country, and they usually last somewhere between an hour or 2 hours. I tend to come to a meeting with a very 1 or 2 key focuses for the meeting. I think that's the way that myself and the Young Adult Panel themselves find works best. If we work on kind of 1 or 2 key tasks in the meeting, it can be the best way of approaching it. We also contact each other between meetings if needed. We have a WhatsApp group, or we can email each other. We also have a shared Google Drive folder where we can work on documents together. And we have a YAP member on the steering group for our project. So I'll give some examples now of our research and grant writing and how the young adults have been involved in that. So the overall aim of D1 now was to develop an intervention to support self-management in young people with type 1. And a key aim was to have the young adults themselves involved in every step of the intervention development. So you could see there, we wanted the intervention to be both theory and evidence-based, but also to have a really strong involvement component as well. So the first thing we needed to do was to create some evidence. So we did a systematic review, the one that I mentioned earlier, and the young adults were involved in that. And then we also did a qualitative study, which aimed to build evidence for the intervention. So the research question was, what are the barriers and facilitators to self-management in young adults with type 1 diabetes? And the methods we used was interviews and focus groups with young adults, parents, and healthcare professionals. So the Young Adult Panel did some training in qualitative research, and after the training, they could take 4 roles in data collection. So they could coordinate the logistics of a focus group, they could coordinate the field notes in a focus group, they could facilitate the debrief, or they could actually co-facilitate the research group with one of the research staff if they wanted to. And they also created interview guides. They contributed to the data collection in those roles, and they also engaged in the analysis and provided insight into the context and themes that were found. So based on the results of the study, 3 main areas were identified for the intervention. So the first was the way that young adults were introduced to the diabetes clinic, to the adult clinic. The second was attendance at clinic appointments and contact between appointments. And the third was building relationships between young adults and service providers. The next piece of development work we did, and the Young Adult Panel were very involved in this, was a conference, which we called the Strength in Numbers Conference. So that was held in Galway in 2016. It was co-organised by the research team and the YAP. And there was 110 people at it all together, including young adults with type 1. There were some parents as well. There was also healthcare providers and policymakers. And the aim of that research was to reach a consensus on strategies to improve engagement, self-management, and ultimately outcomes for young adults living with type 1. So there was a few different types of events at that conference, including a hackathon and a workshop around developing a core outcome set. And the young adults themselves were very involved in each piece of that. So at that stage, we had kind of a draft of what an intervention might look like. So we thought maybe a support worker in the clinic might work well, an agenda setting tool in the clinic might work well too, and we thought maybe a text message kind of support system might work well. But at that stage, we reached a challenge because we were out of money, so we needed to apply for a grant. So this was the first time that we had the Young Adult Panel involved in a grant application. So we applied to the Health Research Board. They had a call for Definitive Intervention and Feasibility Awards in 2017. So the way these, kind of the governance of these awards is structured for the Health Research Board, and I think it's pretty similar across all funding bodies, is you have your PI, so your principal investigator, and that's the person who's leading the work. So that was Sean in this case, Then you have your co-applicants. So that's maybe 5 to 10 people who bring expertise in different areas. So you might have maybe a statistician or a health economist, maybe somebody with expertise in qualitative research. And then you have collaborators, and they're the people who are going to support the work. So in this particular round, this particular stage, the Young Adult Panel were named as collaborators on the application. So the writing was really led by the research team, but the young adults kind of gave some input into it. Obviously, they were very involved in the research that formed the basis of the grant. And as Sean mentioned in his presentation, it's important to highlight that throughout the grant application. Don't just mention it, in the PPI section. They did write the lay summary. Most grant applications require a lay summary. They did do work around planning how the app will be involved in the next round of research. So they came up with ideas around how they might be involved in conference dissemination and in research dissemination, some ideas around social media. And they also planned how the app will be run in the future. So how they would invite in new members and things like that. So we had success at that grant, and we were awarded just under €700,000 to refine the intervention and also test its feasibility. So when we moved on to the refinement work, the Young Adult Panel were very involved in this as well. So we needed to refine the draft intervention components. We also needed to make sure they were feasible in practice. So again, we did a lot of qualitative research about that. So we did interviews and focus groups with young adults and healthcare workers. So the Young Adult Panel members took part in data collection by acting as focus group, note takers and moderators, and they also played a very crucial role in the analysis. So myself and another member of the research team worked through each transcript, and then we identified any piece of data that identified a barrier or made a suggestion for a possible improvement. Then we brought that to the Young Adult Panel, and then we implemented a modification if it was deemed acceptable and useful by the Young Adult Panel members. So we have a paper describing that process if you're interested in reading more about it. Then we moved to pilot randomized controlled trial stage. The main aim of the pilot randomized controlled trial was to investigate if the intervention was feasible and acceptable to deliver for young adults, for type 1 and for healthcare staff. And we also wanted to know if the processes of a full-scale randomized controlled trial would be feasible and acceptable too. So we conducted a pilot RCT. It had 3 arms, 2 intervention arms and a support and a control arm, which was usual care. Our outcome measures, because this was a pilot and feasibility trial, were both quantitative and qualitative. So quantitative, we had some clinical outcomes, and then we also had a booklet of questionnaires to measure diabetes self-management. And for our qualitative outcomes, we had interviews with all participants and healthcare staff to explore their thoughts and experiences of the intervention. So how the Young Adult Panel contributed to this was that they tested and refined the booklet of questionnaires. And in terms of the qualitative work, they created the interview guide. They helped out our qualitative researcher by piloting it with her. And they also gave guidance at the midpoint of analysis of what themes to explore further. So after the pilot randomized control trial, we really wanted to figure out, did all components of the intervention work well and did they work together? And what we found was that the agenda setting tool and the support worker both worked very well and worked very well together, but the text messaging system didn't work so well. And we also have written up that paper if you're interested in reading more about the pilot randomized control trial. So that finished up last year, and that was the end of that round of funding. So we came back to the same problem of not having any more money. We did think that the intervention, consisting of 2 components, the support worker and the agenda setting tool, was feasible and acceptable and worth testing for effectiveness. So we did want to run a randomized control trial of this intervention. So we decided to apply for a grant again. So we targeted the same call because it's a definitive intervention and feasibility award. That particular call targets both randomized control trials and pilot trials. So it was a good fit again. This time the Young Adult Panel were named as co-applicants on the application. So you'll remember the last time they were collaborators. This time they were very much part of the research team, so named as co-applicants. So they have the same standing as the statistician, the qualitative researcher, the health economics researcher. They're very much embedded into the research team. This time round, they were a bit more involved in the writing of the grant. So once again, they were involved in the research that formed the basis of the grant, and we highlighted this throughout. But this time around, they reviewed and gave feedback on the whole grant application. They wrote the lay summary, and they planned future YAP involvement. So they did quite a bit of work in this. They planned that they would be involved anytime a member of staff was going to be hired for the trial, that one of them would sit on the interview panel. They planned that one of them would be on the steering group. They're going to lead out on our study within a trial. And they're also going to lead a lot of our conference dissemination and dissemination on the website and social media. They also, interestingly, we had quite a few discussions about how the YAP will be run in the future. Because we do have that age range of 18 to 25, a lot of the YAP members who were with us from the beginning in 2014, but who joined us in 2019 are now kind of aging out of that. So we had a lot of discussions about how we might refresh the YAP. So they came up with this idea of a mentorship model where we will invite brand new YAP members when we are up and running. And our previous members will kind of act as more senior mentors. So they will mentor the new members who come in. And that very much came from them. So the good news is that we have recently been successful with that, which is brilliant. So we've been awarded 1.2 million to run the randomized control trial. So that should be kicking off in early 2024. So it's a very exciting time for the project team, and for the young adult panel as well. So moving on to lessons that we've learned from this process. A lot of these lessons can be applied to PPI in general, but some of them are specific to grant writing. So an important one is that involvement is not one size fits all. So I mentioned there that the young adult panel reviewed the grant application. Not all the young adult panels did that. Some of our young adults, maybe some of them work in research already, or, maybe are educated to a master's level and, feel able and are willing to read that kind of academic content, whereas some of them aren't interested in academic content and maybe are more interested in what would be the best way of showing our research on social media. So it's very much, different people have different skill sets, and they can bring that to different parts of the process. Also, we run our meetings online, and that works well for our group. But I know in some groups that mightn't work well. Maybe sometimes if people have a condition that maybe is stigmatized, or they aren't that happy being identified, sometimes one-on-one involvement can work well then, when a researcher, calls somebody up and they talk one-on-one rather in a group kind of format. Sean mentioned this already, but it's a really important one. Highlight the PPI throughout the grant application, not just the PPI section. So in your introduction section, in your outcome section, in every section of the grant, you should be highlighting how your PPI panel have contributed to that already. And also, when you're talking about your PPI, what your PPI will look like once you do get your funding, it's very useful to say that you've had PPI involvement in deciding that. An important point just around PPI in general is that always show you are listening and genuinely incorporating their feedback. Whenever I talk to our young adult panel about what parts are working well, what parts aren't working well, what parts need to be improved, they always say that they really appreciate that at the beginning of every meeting, I show what we talked about in the last meeting and what changes we made to the project based on what they suggested. And then that shows that they're valued and they are team members, and it isn't just a tokenistic exercise. And balancing the power dynamics is a really important one. Particularly, I think, with this group, because they're young people, sometimes they can feel a bit shy, and particularly if they're meeting, people who they see as more senior to them, so clinicians and researchers. What can be useful is to always emphasize that we are working in partnership, always emphasizing that they are experts by experience and they have expertise that we don't have. And then quite a practical one that I find useful is that it can be good to have your PPI contributors outnumber the amount of researchers or clinicians in the meeting, so that they have the quantity in the meeting. So moving on to my own personal reflections as an early career researcher, I spent the first 5 years of my research career not engaging in PPI, and then the subsequent 5 years I have been engaging in PPI, and I have found that I required significant upskilling. You do need to be quite skilled in facilitation and communication in order to effectively run these meetings. Sometimes you can have people in PPI meetings who are maybe more confident at talking than others, but it's important that everybody's voice is heard. So you do need to get good at that kind of facilitation work. That often just comes with practice, but it is one that is useful to work on. Communication is key as well. An important one is to always, I have learned to allocate enough time and resources to the task. PPI is time intensive, and it'll always be things that you didn't think of. So you think, oh, we have a PPI meeting this week. You might just think, oh, that would be an hour of my time. But then it would actually be several hours, organizing the meeting, getting in touch with participants beforehand, maybe sending around an agenda. You might be putting up polls in the WhatsApp group. Then, if somebody can't make the meeting, you might have a one-on-one phone call with them afterwards. Then you're writing up what happened at the meeting and sharing that with everybody afterwards. So it takes way more time than you expect. So good to try and allocate for that if possible. Learn from your PPI contributors and take their lead. When I started off doing this work, I was often kind of nervous. I suppose I had a bit of imposter syndrome, that I would be seen as a fraud, that they would realize that I didn't know what I was talking about. And then with time, I learned, it's okay to not know what you're talking about. And if there's things that you're not sure of, often just ask the PPI contributors themselves what they think about it. So maybe you're not sure if the way of running a meeting is working very well, ask them and get their opinions on it, rather than feeling that you need to have the solutions all the time. Think of it as working together as a team. Similarly, learn from your peers and ask for help when you need it. There's a lot more people doing PPI now than there used to be, and we're all having these experiences together. So it can be useful just to engage with your fellow researchers, ask them about their experiences, and reach out for help if you need it. And finally, the extra work can feel burdensome at times. It is a lot of extra time. It will be a lot of resources. It'll take up a lot of your headspace, but it's so worth it. And that's from both the project and the personal point of view. Our project just wouldn't be the project that it is today without the young adult involvement. But from my own personal point of view, the research I've done in the last 5 years has felt a lot more meaningful than the research I did in the 5 years before that. So yeah, I've really benefited from it. So thank you again to DDEA for inviting me to talk today. These are our study team and stakeholders here. And if you have any questions about D1 Now, you can look at our website or contact myself or Sean. You're muted, Gretchen.
Thank you. Thank you so much, Emer. What a wonderful talk. And what a really useful list that you have for our audience of tips, and your insight into what you found meaningful really touched me about your first 5 years and your second 5 years. I realize that we are at 4 o'clock, but I do have a question, and I know there's a question in the chat, so I'm going to keep us here an extra couple minutes. The question from Nicole in the chat is if you paid your panel participants.
Yeah, so we pay our participants. So the system we used in the past was we paid them with a voucher. So there's a voucher you can buy in Ireland that can be used in many shops. So we paid them using that, just because the university systems wouldn't allow us to pay them directly. But that system has recently been replaced with a direct payment into their bank account. So we paid them into their bank account now.
Okay, yeah, good. I remember Sean mentioning that as well too, that there were complications there. But good that the voucher system works also. My question is a little bit related to Nicole's question. The YAP group, are you reaching out and identifying people, or is there actually an open application process? So just a tidbit more information about how you select those YAP members.
Yeah, so it's always been an open application. So we would advertise the 2 times that we did invite more people to join. And we advertised both in clinic and also online. And it was an open application. And then so people could contact me if they were interested. And then I would do an interview is kind of the wrong word. I suppose just a phone call with them to talk about. Sometimes people are a bit confused about participating in research versus being a PPI contributor. So sometimes they think that they are taking part in a study rather than acting as a co-researcher. So I'd have a phone call with them to just chat through what's involved and see if they're still interested. And then we have drawn up a terms of reference as well that we can send to people to show what you'll be doing in the group, what's expected and what's not expected of both the contributors, but also of the research team.
Yeah, very nice. There is also another question here in the chat from Gabrielle. She says, very interesting talk. Thank you. Could you provide an exact example of how you would acknowledge the contribution of PPI in your application?
Okay, so if that's about the application broadly, I suppose a good example from the recent application we put in was that our outcomes for the randomized controlled trial are going to be based on a core outcome set. And we were able to say based on a core outcome set, and this core outcome set was developed in conjunction with our PPI group, our young adult panel. And then if that's more so about how you're going to acknowledge them in the future, in the budget section, we will clearly have identified how much we're going to pay them and give an estimate of that cost and work that into the budget for the grant.
And I might come in there, Gretchen, just briefly, because when we were preparing the application for the definitive trial, Emer and I had some really interesting conversations with our young adult panel around the primary outcome. So in the world of diabetes care and diabetes trial, there's really only one thing that gets looked at, and that's a thing called HbA1c, which is an integrated measure of glycemic control, blood sugar control. And while our young adult panel members recognize its importance, they were very keen that the trial reflect the kind of lived experience by having, well-being or sort of distress or some measure of the life experience become the primary outcome. And I struggled, I think Emer did as well. We went back and forth with them, and although none of them have any experience of trials methodology, I would say, and unfortunately we didn't do this, but if you had recorded the conversation, it was really, really rich in terms of being challenging to us as trialists, and saying, okay, I hear what you're saying, but this is my view. Emer, you remember that? I'm sure you remember that YAP meeting. Yeah.
Yeah. And I suppose, again, that's where I really felt the skills around facilitation and communication were really important, because I was communicating between the young adult panel and the statistician. So yeah, those skills can be very important there.
Mm-hmm. Really interesting insight, I think, and it should give, well, it gives me, but it also should give this group probably quite a bit to think about. Coming into the seminar today, I wouldn't have listed facilitation skills as one of the top tips, but I can fully understand now how important it is.
I mean, I would say I feel very fortunate to be principal investigator on this study, and it is people like Emer, and we have been blessed with a series of really, really strong program managers who have recognized the value of listening to the voice of the young person, and that has been, I would say, hands down, that has been the reason our work has been funded and been successful, is that we're able to tap into that. So please, on the 14th of December, we will be, Emer and I will be interviewing for our next program manager. So hopefully we will continue that sort of trend of because I don't want to, the contribution of the coordinator, the facility, the program manager is massive. This doesn't happen on the back of, goodwill or just wishing it to happen. It takes a lot of effort.
Well, really good luck with that search, and a huge congratulations on the grant, on getting the grant and moving everything forward. I think we should close the session for today. So I close by, again, thanking you so much, Emer and Sean, for your time, for sharing your tips and your expertise, and very importantly, inspiration for all of us. And thanks to all the participants for your engagement today. Wonderful, everyone.
Thanks very much. Good luck to all of the researchers. Yeah, take care.